Hearing loss is a partial or total inability to hear. Hearing loss may be present at birth or acquired at any time afterwards. Hearing impairment can be of different levels of degree. In mild forms, a person may be able to hear some sounds, but it is more difficult to hear the softer sounds. In total deafness, no sound at all, regardless of amplification or method of production, can be heard. And there is a whole range of hearing impairment between the two extremes. When a person suffers from hearing loss later in life, it is known as postlingual deafness, which means hearing loss happens after the person has acquired language or learned how to speak. Congenital hearing loss means hearing loss that is present at birth. More than 50% of all incidents are thought to be due to genetic factors. Other causes of congenital hearing loss includes prenatal infections, illnesses, or toxins which may have been consumed by the mother during pregnancy. Children who are born with congenital hearing impairment are considered to suffer from prelingual deafness, which is profound hearing loss that is sustained before the acquisition of any language. On an average, 3 to 4 in 1,000 children are born with total or significant hearing loss, affecting about 63 million in India alone. Congenital and prelingual deafness comes with a whole host of unique complications because it impairs the child's ability to acquire a language at all. Language acquisition affects brain development as a child hears sounds in their mother tongue and starts acquiring the language. Their brain starts developing the structures to understand the language. Research also shows that there is a sensitive period of language acquisition in which human infants, babies, have the ability to learn any language, which is generally considered from birth until the age of 6 months. Children born with significant or total hearing loss suffer a huge disadvantage in language acquisition if they are not identified in time. Without early identification and early intervention, they cannot start language acquisition, which can further delay or permanently affect their brain development. The delayed or limited brain development not only affects speech development of speech, but also has an effect on their memory, their general learning ability, including vocabulary, communication, intelligence, and even social skills, all of which are necessary for a successful life. Hence, early detection is very, very important to prevent further disabilities in speech, language, and cognition in the child's development. And in order to course correct and to allow the child to lead a normal life, hearing loss, if present, should be detected before the infant is 6 months old. Early identification and detection means early intervention. Early intervention includes therapies, education, and other supports that will help the child reach his or her full potential. Early intervention can be in the form of hearing aids or even talking to the baby in sign language, so that the baby can still acquire language and can produce outcomes which are favorable not only for the family but also for his social development. However, that requires the parents to be fluent in sign language, which may not be the case for most of the parents of children who are born with hearing impairment. Early intervention includes helping parents learn how to spend time with their child in ways that will support their development. Children learn the most from the people who care for them and with whom they spend most of their time. So everyday play and communication with the parents can help the child a lot. Children born with total hearing loss, one of the more efficient and effective interventions can be a timely cochlear implant intervention. A cochlear implant is an electronic medical device that replaces the function of the damaged inner ear. Unlike hearing aids, which make sounds louder, cochlear implants bypass the damaged hair cells of the inner ear or cochlea to provide sound signals to the brain. The implant consists of 2 parts. One is an external portion that sits behind the ear like a hearing aid, and the second part is surgically implanted or placed under the skin. The success of a cochlear implant is based on multiple factors and is not a single-time surgical intervention. Age plays a very significant factor at the time of implantation. It is said that children implanted with the cochlear implant device within the sensitive period of under 6 months have the best outcomes. But implantation under the age of 3 can also reveal good results. However, even beyond that, the implant programming, actual implant use, family support, speech and educational rehabilitation play a very, very important role. One such therapy, known as auditory verbal therapy, also called auditory-based therapy, is a type of early intervention therapy where children with cochlear implant must undergo for 2 years after surgery. The therapy emphasizes listening and seeks to promote the development of the auditory brain to facilitate learning to communicate through talking. It is this therapy which allows the child to make optimal use of fitted hearing technology. In a layman's world, after a cochlear implant, a child must undergo auditory verbal therapy so that the child can hear from the ear, understand from the brain, and respond effectively. In India and across the world, simple and practical preventive measures for universal screening need to be developed further. There is a need for universal neonatal screening as a routine. Each cochlear implant procedure, comprising of the device, the surgery, and the rehabilitation, costs about 6 to 7 lakhs per year. A prohibitive cost not only for the poor, but also the middle class in India. Additionally, the true efficacy of this intervention can only happen with the proper therapy. However, currently even the availability of properly trained and accredited therapists and therapy centers is a challenge, and increase in these numbers are also needed to ensure equitable access for all.